Well, I'm glad we're talking about this because I think in trans circles, people are always looking for like the secret thing that they need to get done. And it's like, oh, nobody's talking about this because it's like incredibly risky and has a super high revision rate.
There tends to be one extreme. You either hear from people who love it or hate it, right? And I've read in research as high as 41% of the people who have that surgery then get another surgery.
Like I think probably a smaller percentage of trans people are accessing gender-affirming voice surgeries than people think. Like most people are getting what they need through training.
I've never spoken with anybody who has only done voice surgery and been delighted that they got all the way to their goals.
Hi, I'm Renee, and I'm a gender-affirming voice teacher. If you clicked on this video, you're probably considering voice feminization surgery. Maybe you're wondering what types of surgeries are available? What are the risks? How do I know if this is the right option for me? In today's video, I invited voice-specialized speech-language pathologist and founder of Harmonic Speech, Tallulah Breslin, to chat with me about voice feminization surgeries. Here's our conversation. Hi, Tallulah. Thanks so much for joining me today.
Yeah, I'm so glad to be here.
Awesome. So if someone was interested in voice feminization surgery, where would they start their research? What do you recommend?
So I think currently the gold standard for voice feminization surgery or pitch floor raising surgery, because people of any gender identity can get it, some people who are non-binary may also want to seek it, is the Glottoplasty surgery. Endoscopic Glottoplasty surgeries first began with the Wendler's Glottoplasty, where you create a web that shortens the vocal folds about 33%. On average, just that surgery can raise your pitch 20 to 24 hertz. And then if you combine it with voice training, you can get about double that pitch increase.
Can you explain what creating a web means?
Sure. So the vocal folds have two layers. They have a mucosal membrane, I guess kind of three, but there's the mucosal membrane on the outside, and with a laser, you would cut that open, and there's kind of gel-like layers and then layers of muscle. And they sew a web that makes those layers all come together into being a single piece, which shortens the vocal folds and makes it so that the part that is operating is shorter, and therefore you're at a higher pitch, because the length of the vocal folds, which we adjust all the time when we're talking and changing pitch, is now shorter, and therefore the pitch is higher.
Okay, so you mentioned Wendler's Glottoplasty, and that was something that I talked about in my surgery video. And honestly, that was the only type of surgery that I'm familiar with, or that I understand to be like quite popular. But you were telling me about a modified version. Can you tell me a little bit more about that?
Yeah, so basically the Wendler's Glottoplasty is used widespread among surgeons, and so over time people have developed modifications in an attempt to improve it. And those have been things like in the part where the web is, inserting fillers to try to bring them together more, or using a fibrin sealant instead of a suture so that it dissolves over time, or using a laser to thin it. There's all these different things. And there's one procedure that's come out, the vocal fold shortening with retrodisplacement of the anterior commissure, or the VFSRAC. It is basically 2.0, right? So the web can be up to 50% of the length of the vocal folds. They go in and they remove a little bit, so there's less mass there. The sutures are permanent instead of dissolving, so that you get a longer lasting impact. And then the biggest part that's different is that the sutures, instead of just staying there, they get attached to the anterior commissure or to the muscle right below. And so what that means is you get additional tension. And so when we think about voice sex, we're talking about kind of different elements that contribute to how the listener hears the body. And we're now looking at combining two different effects. So we're lightening the voice and making the pitch go up, which has more impact on listener perception than just the Wendler's Glottoplasty. And it is often combined with that longer length, which can further increase pitch, but at potential more risk to vocal quality.
And so and you were saying that tension creates a lighter sound because I guess it's like mechanically thinning the vocal fold as well.
Yeah, so if we think about the vocal folds, we have two different tension relationships. One affects the length, and so if you make them shorter, then you are on that two-dimensional aspect. And that's been the issue with a lot of vocal fold surgeries over time, is that they're really only doing that. Whereas when you think about the 3D way of looking at the voice, if you're able to thin them as well, then you start getting a lighter tone. Their surgery was developed by Dr. Kim at the Yeslan Center in Korea. And it used to be that to get that procedure, you had to go to Korea. And because of that, they would insert Botox into the vocal folds to kind of force vocal rest, because they didn't have a relationship with speech-language pathologists to do pre and post-op care. And now the surgery has become more common in the US, where I am, where there's, I think, 7 surgeons that I know of doing the procedure here in the States. And they are not all having to do the Botox, which has some negative side effects associated with it, because they have relationships with speech therapists who can do post-op care.
Okay, is that common, Botox with all types of different surgeries to force, excuse me, to force vocal rest?
So I've only seen Botox used with this particular surgery, and it is common for things that are not voice feminization, right? Like I've had plenty of Parkinson's clients who had Botox to help their vocal folds come together better, or somebody who has a unilateral paralysis of their vocal folds to help bring the one that's not operating correctly to the midline so the other one can handle the slack. But it isn't something that to me, when I see clients get Botox as part of their voice feminization surgery, it takes them longer to recover. And so it just makes their journey longer.
I see. Okay. Wow. And of course, there's other types of I guess, pitch floor raising surgeries or voice feminization surgeries. And I wanted to talk about some of those. In our list here, we have a whole list of questions that we were talking about earlier. We were looking at the cricothyroid approximation. Can you tell me about what that is and who is a good candidate for that?
Yeah, so a CTA is a surgery that adjusts the relationship of the large cartilages on the outside to one another to attempt to create more tension for the vocal folds, which it does very effectively. And it's an open surgery, so you get a neck scar, versus the glottoplasties that are endoscopic, where there is no neck scar. And by only adjusting the voice from the outside, you don't get some of the same risk of things like hoarseness and reduced volume that you do from surgeries that operate directly on the vocal folds. It's very effective at increasing pitch, and you can talk immediately after the surgery. Some surgeons will even have you talk during the surgery.
Wow.
The downside is, yes, you talk during the surgery, you found your perfect pitch, you're super happy, you've recovered. Within a year, you will have seen a decrease in your pitch, and within a few years, it will be gone entirely for most people who have the surgery. So if you are, maybe having a tracheal shave from a doctor who does the surgery already, you don't want a glottoplasty because you don't want the vocal risk from that, and you are too dysphoric to do voice training, like there's a particular client type that may make that choice. Unfortunately, the majority of the people who I've seen who've made that choice have gone to doctors where it's like their special sauce surgery, where they don't tell you what it is, and it's like, oh, I'm Dr. So-and-so, and it's my secret surgery, and it's fantastic, and look at these great results, but there's no long-term evidence because the pitch change doesn't hold up. But this kind of like, if you fully understand what you're signing up for, there really is this particular situation in which it's an appropriate surgery for you, because you get the increase in pitch and you go directly into voice training to be able to change your pitch over time with voice training, which voice training does. And then it sort of makes up for the loss in pitch, because as your pitch goes up from voice training and you're losing pitch from the surgery effect going away, it sort of flatlines and you end up in a good place.
Right. So people who are maybe too dysphoric to do voice training initially are able to start voice training because they feel less dysphoric right from the jump. Yeah?
Yeah, exactly.
Okay, cool. So let's talk about risk. This is like a big topic when it comes to all voice surgeries, but especially voice feminization surgery. Are there any procedures that you would deem too risky to do?
So I think everybody's risk tolerance is different. There's 2 particular surgeries I think of when I think about risk. One of them is a LAVA, and that's because the surgery is not a voice feminization surgery. It is a laser thinning of the mucosal membrane, and it stiffens and scars the vocal folds without very much of a pitch increase. So it's kind of like you get a cost without a benefit. And that's why
Wait, what does LAVA stand for?
LAVA stands for laser assisted voice adjustment. So a lot of times people will say, oh, I want to get my vocal folds lasered down. And they're talking about LAVA, where they're going in to try to decrease the cover and stiffen and scar, so that the idea is that rather than physically shortening it with a web, you would shorten the functional area by having part of it not move.
Oh, by like reducing the functionality of part of the fold.
Yeah,
Wow.
which, I mean, inherently you should hear that and understand the issue with it, right?
That sounds really risky. Is there anyone else who does that? Like, is there any other type of person with a different type of pathology or something who would want that kind of surgery?
I mean, I haven't researched the LAVA for other types of care. I know that it is not something I have ever had a client get for non-voice feminization. But what I have seen is somebody went and they had a procedure to feminize their voice and they weren't happy. And so they went back to get like adjustments with lasers. There are some people who are kind of trying to do a 2.0 to the LAVA. They're calling it a laser reduction glottoplasty, where it's basically the same thing, but they're also going into the muscled body and trying to decrease the mass, kind of like on a 3-dimensional level. And it has the same issues with stiffening and scarring the vocal folds, but that is kind of where how they're trying to turn it into voice feminization surgery. And like using lasers is a whole like little category that is still being explored. There is another surgery that is just, the risk is so high, I'm still surprised that people get it, but it's called a feminization laryngoplasty, or a FemLar. And I've read in research as high as 41% of the people who have that surgery then get another surgery. And when you compare that to a Wendler's glottoplasty, there's between 0 and 14% of the people who have that surgery would go on to get another surgery. And there's like a lot of potential benefit because you're completely rearranging everything, and that can affect resonance, which none of the other surgeries can do. But when you sever the vocal folds from the interior commissure, it's very complicated to get the tension right when you reattach them. And the result can be diplophonia, or 2 pitches, because they're not vibrating the same, or the plate where you're connecting them can get infected, right? So it's a really risky surgery. So
41% revision rate is like shockingly high. Can you describe a little bit more about what they do? Like from Wendler's glottoplasty, they remain connected the whole time, right?
The FemLar is the only surgery that I know of that actually disconnects the two. Every other surgery tries to operate on the outside or directly on the vocal folds, because it's a really bad idea to sever them, but they disconnect them at the vocal fold ligament, and they try to rearrange the cartilage tension, kind of like a CTA, but with more potential mobility. And I'm sure you can find a video that goes into more technical description about it, but it is trying to change resonance and the pitch at the same time. And it's just the way it's been explained to me is that if it were a better surgery, you would find it being done by more than one surgeon.
It's only being done by one surgeon at the moment.
So I am only aware of one surgeon. I know of a second surgeon who did a fellowship with the primary surgeon who does it, and to the best of my knowledge has never actually chosen to do that surgery, or at least not in a way that was public, since they finished their training. And maybe they are, but the people who I've seen who spoke with that surgeon, he's discouraged them from having it. So
well, I'm glad we're talking about this, because I think in trans circles, there's like, we share information on like a community level, and people are always looking for like the secret thing that they need to get done. And it's like, oh, nobody's talking about this, but there's a reason why people are not getting it done, because it's like incredibly risky and has a super high revision rate.
Yeah, and it is. And, there tends to be one extreme. You either hear from people who love it or hate it, right? Like in general. And I think if you read the research, it's pretty consistent that whatever the surgery is, even if it didn't actually improve the pitch that the people were trying to raise, people are happier after the surgery than before, because something has happened to help them feminize their voice. And that satisfaction tends to go down over time as they start to see that maybe there are still things to train, that it didn't change everything, but people do tend to be more satisfied with their voice after surgery.
Interesting. I mean, this is something I wanted to talk about too. Like, I feel like when I was doing research for my surgery video, I tried to watch a lot of like first person testimonials to see and read testimonials from people who had had surgery to like get a sense of what the satisfaction rate is like. And it was like, there was just two completely separate things. Like people either were obsessed and were like, this is the first thing I should have done. I love my surgery. And other people were like, didn't really help me. Kind of wish I hadn't done it. I still have to do a bunch of training. Is that what you're also seeing? Like these two different types of satisfaction?
I mean, so I think that the more informed that people are about the different components beyond pitch, the more likely they are to see that their pitch went up and the other things didn't change, and recognize that in order to reach a more naturally feminine voice, that they're probably going to want to work on training as well. Whereas if somebody doesn't have that exposure, they aren't aware that there are other factors besides pitch, they're more likely to be satisfied, but they're also more likely to seek out a second surgery because they'll, maybe talk in the phone, get misgendered, and then go back to the surgeon because their pitch isn't high enough, because they don't realize that it's something else that they're seeking.
Or their pitch, yeah, exactly. Or their pitch isn't the component that is causing the dissatisfaction, and that's all that the surgery addressed. And so I was wondering if you could talk about the tracheal shave and whether or not it affects the voice and what it is also.
Sure. So a chondrolaryngoplasty or a trach shave is operating as a neck contouring surgery. So there are three terms that refer to the same part of your body: the larynx, voice box, or Adam's apple.
Just a note, some also use laryngeal prominence or thyroid notch to refer to the protruding part of the larynx. Now back to the interview.
And in somebody who's had first puberty testosterone exposure, what's thought of as a male puberty, the voice box gets larger and therefore is more visible. And that's why it will get called an Adam's apple, but it's the same anatomy. And so you can go in through an open surgery. Typically, there are now some methods to go under the tongue. Most of the time it's open, and shave down the top part of it. The issue comes up in that the vocal folds insert right below. And so if you shave too low, then you can damage the anterior commissure, or the place where the vocal folds connect. And there's a really easy fix to protect the voice, which is you go in with a camera and you look at the vocal folds and you put a needle where the vocal folds insert into the cartilage. And that allows you to do two things, both good. One is it lets you maximize how much you can remove because you know exactly how far is too far. And the other is that it keeps you from shaving too low so you don't damage the voice. So the surgery is inherently not a voice surgery, but if it isn't done safely, it has the potential to damage the voice.
What if a person was going to get a tracheal shave and wanted to ask their surgeon if they were going to do this safety measure? How would they phrase that?
They would ask their surgeon what they were planning on doing to protect their voice.
Okay, let's move on. I really want to know now about side effects and complications. So can you tell me what are the most common complications or side effects that people experience when they have a pitch raising surgery or a voice feminization surgery?
Yeah, so if we look at a glottoplasty type, and there's some variations, but that type in general, after the surgery, you have 2 weeks. Typically, there can range where you don't use your voice at all. And just 2 or 3 days of not using your voice on their own without any surgery can damage it. So when you look at the 2 weeks of non-voice use, you then come out of it with like a hoarse roughness to your voice. And for most people, that lasts for 2 to 3 months. And then for some people, it goes on and there's just a quality impact that they may or may not be sensitive to, but it typically decreases over time. And then there's also, in order to set the vocal folds in motion, you need more pressure once they're shortened with a web. And so you aren't able to be heard in a loud space. Projecting, yelling is more challenging post-surgery. Then the range of your voice tends to decrease. So you're losing lower and upper notes when it goes well, right? And sometimes it can become a very narrow band. The pitch outcomes aren't always what you hope for, that you might want your pitch to go up, but your pitch might not. It might go down, or it might go up so high that you're above the fem range and you sound childlike. And that's especially risky if your pitch starting is very high, right? Like when you have these people who have pitch already in the fem range who have glottoplasties and their pitch gets very, very high after, or it can. The surgeries that aren't webs, that are some other type of procedure, you would expect the pitch to go down over time. So even if you are satisfied with your initial results, yeah, that can decrease.
Wow, I didn't know that not speaking for 3 days can cause damage. Can you speak on that a little bit? I'm just curious.
Oh, well, no, I just went to the Fall Voice Conference and they were talking about, so the biggest variable in how long, like this is in general across all voice surgeries, not this voice feminization area in particular, but the biggest variable in how long people are recommended to rest their voice after voice surgery is the surgeon's schedule. So there's just a huge variability in what's recommended because it's like, well, I can see you in 2 weeks and I can see, right? But not using the vocal folds makes things not operate correctly. And so if you think about waking up in the morning, right, like you haven't vibrated your vocal folds all night, and so there's kind of some fluid accumulation, well, over the course of days that turns into atrophy.
I guess that happen with any muscle as well. Like if you're bedbound because of illness, then you can have muscle atrophy as well. So it makes total sense. Wow. Have you ever had to help a client like undo that atrophy after surgery?
Yeah, I mean, everybody post voice feminization surgery who had a rest is doing that.
They all have that.
Yeah, and I've worked with other clients who've had other types of surgeries as well. But it's a process that you go through to recover your vocal function and then hopefully improve it beyond where you were before.
Do you find that people are like kind of depressed after surgery because of this sensation, like during the recovery process?
So I think the more informed somebody is about what to expect after surgery, the better they adjust. So if they know going in, right, I'm not going to talk at all or clear my throat or cough, and here are some techniques that I can use instead of doing those things. And then at 2 weeks, I can start voicing for 10 to 15 minutes an hour, not in a row, like over the course of an hour. I can have this small amount of voicing for another 2 weeks, which is relative voice rest. And then I'll increase how much I can talk over time and getting back to normal, not start out immediately after the surgery. Then those people tend to have their expectation met. Whereas if somebody wasn't informed, they might be more surprised. And yeah, one of the big deals that happens if people don't do the pre-voice therapy, right, pre-surgery voice therapy, is that they don't get rid of the tension. And so after the surgery, there's a lot more mucus, and then that's just really difficult to deal with if you don't have techniques besides clearing your throat, and that increases, and it's just like kind of can be very frustrating. So I think the more informed and skilled you have tools to manage, the better your recovery process is.
Makes total sense. I think it's like that with any surgery, and especially with any gender-affirming surgery. I mean, I've had top surgery, and I remember I was expecting back pain and neck pain, and I was expecting to have trouble getting up out of bed. And you know, I felt fine with all those problems because I knew they were going to happen. So it makes sense. Okay, my next question is, why should voice surgery be the last surgery in someone's transition timeline? I don't think a lot of people know this. I think this is like a hot topic, but a lot of people don't realize it should be the last one that you get. And why is that?
So basically, because the most common surgery is some form of glottoplasty where you're creating a web, you're shortening the vocal folds. And whenever you are intubated to be put to sleep for surgery, you have to put a tube through that opening. And the anesthesiologist can use a narrower tube, a smaller tube like you would use for a child. That's the size they would use. But inherently, they're humans, right? And so they can potentially nick the web and damage it. And if you have your other surgeries first and the voice surgery last, you decrease the risk of damage.
And do you think it would be wise if someone has had a Wendler's and then like is having some kind of different surgery, like a knee replacement or something later in life, to inform their anesthesiologist that they might need a smaller intubation tube?
Yes. Yeah.
Great.
Absolutely. Right? Like
I don't think a lot of people know to do that. Like I wouldn't have even thought about different sizes of intubation tubes.
Yeah, and they have different sizes there, so they'll figure it out. But if you tell them, then the first one they go in is smaller.
Okay, fascinating. Um, so, who tends to benefit the most from voice feminization surgery or pitch floor raising surgery? Like, who is the best candidate for these types of surgeries?
So I think that people who have done the work to train their voice and aren't happy either with their outcomes, or they aren't happy that they have to think about raising their pitch some of the time, are more likely to be satisfied with the surgeries. I think sometimes people whose starting pitch is very low may not be satisfied with voice training, they even if they do train their voice effectively. I also think that at the point that somebody decides that they need surgery to be happy.
It's true. And I will say, even some people with low pitches, like starting pitches, can create standard feminine pitch. Like I've seen it happen. I'm sure you have as well. So that doesn't necessarily mean they won't be happy with voice training. But that thing you said about having to think about modifying the voice and about changing the pitch, that's a question I get all the time. When will I be able to create this voice without thinking about it? And I often tell people, like, it can become a habit over time. But have you ever seen people who, like, despite their best efforts, it doesn't become a habit and then they opt for surgery?
So I think of it as there being these two voices, right? So you start out and you have this low effort habitual voice, and then you
Mm.
have a higher effort voice, and then you have a goal voice, right? So when I'm not thinking about my voice at all, it's here. When I try to talk in a more feminine way, it's here. And then when I'm thinking about what I ultimately want with my goal, it's here. And over time, this low effort and high effort voice shift towards the voice that you want. And at a point that people are satisfied when they're not thinking about their voice, and that when they are thinking about their voice, it's even closer. That's kind of when they graduate themselves and say, I'm good.
I'm done. Yeah.
Often, as people go through the process, those changes are slow, and so they won't realize that their habitual voice has changed. And they'll only see that if they put in more effort, they're able to get farther. And so comparing recordings can be really helpful. I also want to reference what you just said about pitch. So often people think that they have a particularly low pitch, and that isn't always accurate. And we know that pitch isn't everything, right? So when somebody has a particularly low pitch and they put in all the effort for voice therapy, they may not be happy, but definitely that doesn't mean that just having low pitch means you're going to need surgery.
Absolutely. I'm glad you brought that up, because I know we're talking a lot about pitch today, but that's because that's what the surgeries affect primarily, right? But a lot of the work that we do in voice feminization and gender affirming voice is modifying resonance by changing the geometry of the vocal tract, right? So it has nothing to do with the pitch. Oh, we can raise the pitch a little, but pitch is just so anyone watching this and thinking, oh, this pitch must be super important because we're talking about it so much. It's actually not as important as you might think. I'm sure you agree with that, Tallulah.
Yeah, so basically with first puberty testosterone exposure, your vocal folds get longer and thicker, and your body, which also means your vocal instrument, gets larger. And so we hear acoustically what those differences make to the voice. And so if you make your vocal folds shorter to have a higher pitch, you've changed 1/3 of the primary variables that contribute to listener perception of voice sex, but you haven't changed the others. And so sometimes you might want to work in the other things to have a fuller voice, even if you get voice surgery.
Couldn't have said it better. Why would somebody maybe want to wait to have surgery? Like, what would be a good reason to put it off?
If they're interested in behavioral training and they haven't done it yet, that might be a reason to have the training first and wait on the surgery. If somebody isn't sure what their end goal is and they want to kind of explore their voice and figure it out. If somebody has any kind of vocal health issues that they want to resolve first, typically the best outcomes come when people start with training their voice, then have the surgery, and then do voice therapy afterwards for people who choose surgery. And that's the longest potential path of feminizing your voice time-wise. And so maybe you want to commit to doing that process at a later time when you don't have as many obligations. So those are examples of reasons. Maybe you want to wait where you have, like over the summer, you can rest your voice more easily. But I also think with the sort of changing dynamic of things right now, sometimes it makes more sense to get surgery because you don't know if access is going to be denied to you in the future. And so maybe not waiting for your particular insurance situation, etc., might make sense.
It's kind of ironic, isn't it, that like all this political situation to like remove gender affirming access, gender affirming care access is kind of forcing people to access care that they might not even need. And I know a lot of like your clients and my students never need surgery. Like I think it's probably a smaller percentage of trans people are accessing gender affirming voice surgeries than people think. Like most people are getting what they need through training. Do you agree with that?
I mean, I think most, like we know, looking at research, most people who feminize their voice do not have surgery. It's a very small percentage of people who do, and which it's a valid choice. You can choose that, but most people don't make that choice. And I think that it's the right choice for some people, and it's unfortunate if people are forced to do anything with their bodies that they weren't ready for. But yeah, I've many thoughts of things that should be better, and it doesn't automatically fix things. So
I do wish you were in charge more, Tallulah. I think that it would be a better world.
I would be perfectly happy for you to be in charge as well. But yeah.
Okay, I do want to talk a little bit about singing because we haven't touched on that at all. And I don't talk a lot about singing like on my website or in my YouTube channel, but it is a consideration. So what about people who use their voice professionally, like a singer? What would be different for them in pursuing this type of surgery?
So the changes to the voice would be similar, but the cost would be higher, which is why most singers are discouraged from getting voice feminization surgeries. When you sing, you typically sing in a much wider range than you speak in. And so that decrease in pitch range is something that people are much more sensitive to. There's also a quality impact that, like very small voice quality changes your slightly hoarse singers are really unhappy with, whereas a speaker may kind of tune it out or not even notice it. There's also a specific issue with how much force it takes to put the vocal folds into motion being higher with singing than it is with speaking. So with speaking, maybe you can't get as loud as you used to, but you can solve for that. Whereas with singing, it can make your ability to sing be impacted.
Mm-hmm. So what do you wish more people knew before pursuing voice feminization surgery?
I mean, I think people would be best served by having a clear understanding of what variables are contributing to listener perception, and that they can then make an informed choice. And I think understanding the value of really working on your voice and getting it to a good place prior to having surgery so that you can maximize your benefits is also something that I would like people to know. But I feel like once people really understand those things, then it's a matter of they can make a choice, like, are they good with this recovery process? And there are people who don't want to do any kind of voice therapy at all, which is an acceptable path. That just, you kind of like you have to have your expectations adjust
In line, yeah.
Yeah.
That's fascinating. There are people who don't want to have any training at all and opt to only have surgery. Is that a path you've seen?
Yeah, I mean, I've met some people like that, and I think when I've talked to people who truly have had no training whatsoever, there's sort of like a grudging acceptance of the fact that there is more that could be changed and that they're not happy about not having that, but they don't want to put the energy in, at least not yet. And they're happy with the change of the surgery. They just feel like at some future point they'll do something to finish their voice. I've never spoken with anybody who has only done voice surgery and been delighted that they got all the way to their goals.
Right. Yeah, because then, I mean, you watched my video on gender affirming voice surgeries, and I say, like, training is a part of the process, kind of whether you like it or not. Like, I think most surgeons would even recommend doing like attempting to modify the voice through training alone before considering surgery.
So I think it depends on where you're at. I know we'll just say like reputable surgeons will want you to do pre and post. They'll want a letter from a speech pathologist that says that you've attempted voice training beforehand, so that they know that there's a speech pathologist that you have a relationship with to then do post training with. And I mean, if somebody isn't interested in doing voice therapy, then they should not be forced to. And if somebody has to resist being told that they have to do something, it just sort of makes them less interested. So
Actually, well, this leads me to my next question, which is, how do people even choose a reputable surgeon? Like, what should people look for or avoid when they're looking for their surgeon?
So I think the most important thing is to find somebody who does a voice feminization surgery regularly, rather than like 1 or 2 a year. And then you want to look for the surgeon who does them regularly that is closest to you. And once you've identified, like, oh, you do surgeries, this is the thing that you do, and you're as close to me as I can find, then you would pick the type of surgery that surgeon does regularly.
Okay, so if you have a surgeon who always does Wendlers or always does cricothyroid, that's like better than someone who does it once or twice a year.
Okay, I will qualify that with, you would pick the type of glottoplasty surgery that they do most often.
Okay, that's good.
Yeah.
Thank you for qualifying that. I've learned a lot today, Tallulah, so I really appreciate you coming on. Is there anything we haven't covered yet that you want to make sure is said?
You've asked really good questions. I think that, my basic overview is that voice feminization or pitch floor raising surgery is an option. It has benefits and costs. It's best if people are fully informed about what they are and what that recovery process will look like and what is needed to fully feminize their voice outside of just the surgery. But as long as you're informed, you can make whatever choice you want about which path to go. And both surgery and not surgery are valid paths that can get you to your voice goals.
Thank you. And maybe someday you could come back and we can talk about the masculinizing side of things.
Oh, yeah. That's surgery for voice masculinization is less common, but it does happen.
So we'll have another conversation to talk about that. And where can people find you if they want to learn more or get support from you?
Yeah, you can just go straight to my website, which is harmonicspeech.com, HARMONICSPEECH.com, and go ahead and reach out to us. We have 7 speech pathologists in 8 states, and we'd be happy to help if you're wanting to change your voice.
Thank you so much, Tallulah. It's been a pleasure.
Yeah, thank you, Renee.
Thank you so much to Tallulah for taking the time to chat with me. If you want to connect with them, you can find them at harmonicspeech.com. Let me know in the comments what you think of this type of video. This is the first one we've had on the channel, and if it's something you enjoy, we will definitely do more in the future. As always, don't forget to like and subscribe for more trans voice education information. And if you're ready to dive deeper into your voice journey and get exclusive tips, free resources, and motivation straight to your inbox, join my mailing list. It's the best way to stay connected and take the next steps towards a voice you love. Click the link in the description to sign up. That's all for today. I've been Renee, and I hope this helps.